Conditions at one Essex care home. And with that care home in Harlow, joining me in the studio now is the Conservative MP for the town, Robert Halfon. Morning to you.
Good morning.
Robert, thank you for coming in this morning. What's your reaction to what we've heard this morning?
Well, it's quite shocking, and some of the things that we've heard today, and I thank BBC Essex for doing this investigation, would make anyone weep. Stories of patients being left in faeces, stories of drugs going missing, stories of residents being sat upon by staff. I should say I've been to Partridge Care Home, and there are some very hard-working, excellent staff there, but nevertheless, this is a very damning story and incredibly worrying, and there are a number of questions and answers that need to be given by relevant people.
Well, you've said in the past that if there was continued poor performance at the home, you'd want the county council to take the home over. Are you happy at the present time that Rushcliffe are organising it as it should be?
Well, I first heard about problems in Partridge Court last year, and I was contacted by residents and contacted Partridge Court and the local authority. This is something that's been going on for a long time, and your report today says that the documents produced internally are showing things since the end of 2010. I believe that there are a number of actions that need to be taken. First of all, I'm going to be contacting the Health Minister today to go through what has been happening at Partridge Care Home. I also believe that the owner of Rushcliffe Care Home has a duty to come to Harlow and hold a public meeting for residents, for the families of residents and the friends of residents, and to publish all the internal reports to show what has been going on and to answer questions and to show how they are going to try and improve things. The Care Quality Commission has got another report coming. As you've mentioned, there's been four previous reports that have been pretty critical. I think that Partridge Care Home are in essence in the last chance saloon here. Unless things start to improve, things are getting very serious indeed.
But this is an organisation that has other care homes as well. I mean, some people might think, but they've gone past the last chance saloon.
Well, and they may be right to think so, and we will wait for this forthcoming report from the Care Quality Commission. I'm going to be raising this with the Health Secretary. I believe that there needs to be a full inquiry into what is going on. I'm going to be bringing this up in Parliament later in the week when Parliament returns tomorrow. As I said, the Rushcliffe Care owners need to come to Harlow and hold a public meeting, publish all these internal reports, publish everything that's going on, and have a full and frank discussion with residents and friends and family of residents so that people can know for sure what has been going wrong and what action they're taking to deal with it.
Robert, we've had, as you can guess, a number of tweets, emails on this topic. Here's one from Stephen. Why does this keep happening, not just in our county, but around the country? Aren't they inspected like dentists and hospitals? And that points to the Care Quality Commission. If they are inspecting them, are they doing it properly?
Well, the Care Quality Commission have been in a number of times, and they published 4 reports that have had a number of significant criticisms, including, for example, the way drugs are handed out at the care home. There is another report coming up, and I believe that if the report is again critical, Essex County Council need to take control over the care home, something which I asked for last summer.
Let's go to another communication we've had from Joe. If you don't care, you shouldn't be working in the service. The wages are poor, the work is physically and emotionally draining, challenging, but the rewards are great if you care and if you do the job properly. That perhaps poses the question, and one of the relatives we'll hear from a little later has questioned the number of staff there. Should there be a minimum number of staff for so many patients?
Yes, you make a very good point. There is nothing wrong with having private care home, just as we should have both private and public. But what we need to do is to ensure that there are minimum standards, and there have to be the required staff. This is a complaint that has come through again and again and seems to be the root of the problems at Partridge Care Home, is that there haven't been enough staff. And if that is true, then absolutely there need to be minimum standards and minimum regulations, and those who break those regulations, either the care home should be closed or they should be fined substantially.
4 critical complaints, reports from the Care Quality Commission. Has the time come to question the privatisation of these homes? They were once owned by the county council. In many cases, the staff have been upset as to what's happened. Now we're getting patients that are upset. How far do we go? Shouldn't they be back into public ownership?
Well, to be fair, there are things that have gone wrong in publicly owned care homes as well. But I am coming to the view that, given what is going on, that some of these care homes should be perhaps turned into not-for-profit organisations and run by local charities, so you get the actual care and dignity and support that the residents need.
Pains to say that there aren't problems in every care home, and that's emphasised by Joe. We just struck gold when my mum went into a care home. This particular one was in Braintree. Everybody there just loved and cared for all of the residents. That I have no complaints at all. You should expect respect. And this is the bit that stuck out when I read Joe's email. Care homes are the residents' homes. They're paying for that service, not by choice, but by the cards they've been dealt. We must always remember that. They were young people once with dreams, loves and families, and that is just, I mean, that says it all, Robert, really, doesn't it? You've just got to expect that dignity and respect if your mum, your father, or even yourself going to a care home.
I mean, care homes should be very special places indeed. It's, as you say, dignity. It's a place where the elderly know that they're going to be looked after and cared for, both by the people in the care home and by their staff. So anything that goes wrong on a scale, as it seems to indicate in your report today, is unforgivable.
There's one other thing that stuck out with James when we were hearing from him of the internal investigation and from claims from relatives as well. The place just smelled of urine. I mean, that's going to put you off from the minute you go in. Does it still smell of urine?
Well, I've been to the care home and I had a good experience when I went round. I'd met some very hard-working staff, and I didn't have come across such things directly. But nevertheless, these things clearly have been going on, and that is what is unforgivable. And as I say, the Rushcliffe owners need to come to Harlow, hold a public meeting for the residents, for the patients, for their families and their friends, and publish all these internal documents to allow people to judge and explain to people why this has happened and what they're going to do about it.
And despite their 4 critical investigations, does the Care Quality Commission care? Is it strong enough?
Well, it's a pretty tough inspection body, and they're doing another report. Their Partridge Care Home are in the last chance saloon. They have to demonstrably show that none of this will ever happen again. I think they need to speak to, again, to some of the residents who've been affected by what went on, and make sure that they're doing all the things that the Care Quality Commission are asking them to. If not, Essex County Council must step in and take over the home.
There are still residents in that home. There are relatives of those residents possibly listening this morning. What would you say to them?
Well, I would say to them that there are many good things happening in the home, and there are many good staff, and I think that was even reflected in your report. There are things that have gone wrong in Rushcliffe Care Home that need to be answered. They need to be frank and open about it. And if there are any issues that you are concerned about, please don't hesitate to contact me on email at halfonforharlow.com or through my website.
OK, Robert, thank you very much for joining me. Conservative MP for Harlow, Robert Halfon.